In this video, I'm going to give you an overview of the muscles that you're going to find described in lessons 5 and 6 of your lab manual. Muscles of the hip and thigh, and then of the leg and foot, respectively. The previous lesson in your lab manual gives you a little bit of an introduction to skeletal muscles, and so I just want to review a few of those key components before we move on to the muscles themselves. So parts of the skeletal muscle. Skeletal muscle fibers between the fixed ends of the muscle make up the belly of that muscle. And each muscle begins at an origin and ends at the insertion, and then it contracts to produce a specific action. The origin of the muscle usually remains stationary during the contraction, and during that contraction, the insertion is actually going to be the point that is actually moving. Now, when a muscle moves part of the skeleton, that movement occurs across a joint, and the action is described based on how that specific joint moves. So muscles are organized into three primary categories based on their primary actions. An agonist is a muscle whose contraction is mostly responsible for producing a particular movement. An antagonist is a muscle whose action opposes that agonist. So for example, if an agonist produces flexion at a particular joint, an antagonist would extend that joint. And then a synergist assists the agonist in performing its action. So what kind of actions are we going to be talking about here in the lower limb specifically? Muscles of the lower limb will contribute to several categories of actions. Flexion, such as you can see in the top picture here. This is illustrating the difference between flexion and extension of the knee. Flexion occurs when there is a decrease in the angle between two body parts. So for example, when that leg is straight at the knee, there is 180 degrees between the thigh and the lower leg, but when that knee then flexes, you can see how the angle between the thigh and the leg is going to decrease. Extension is then the exact opposite. It results in an increase in the angle between the two body parts. A second motion that we're going to see in the lower limb is the abduction and adduction, which you can see illustrated here on the right. Abduction occurs when the body part is moving away from the midline, and adduction is moving towards the midline. So think about when you abduct something, you take it away. So the body part is being taken away from the midline of the body. While adduction, ADD, you're adding it back to the body. And then this image that you can see here on the right side of the screen is depicting lateral and medial rotation, and that occurs along the longitudinal axis of the bone. We're going to see examples of adduction, abduction, flexion, extension, and lateral and medial rotation in other parts of the body as well, not just in the lower limbs, but there are a few actions that are specific only to the ankle and the foot. Dorsiflexion is the action of pulling the toes upwards towards the anterior crural region, and plantar flexion is the exact opposite. That's the pointing of the toes. And then we can also talk about inversion and eversion of the foot. So inversion of the foot is angling that plantar surface towards the foot medially, and eversion of the foot is angling that plantar surface of the foot laterally. Don't be confused by this image here. You may initially look at it and think that this are 2 feet right and a left from the same person, but note that this is a right foot. So here's that first digit, that big toe, and you can see how so then we know that this is the medial side. So this is inversion, taking that plantar surface and angling it medially. And again, here's digit 5, digit 1, digit 5. So we can see that that eversion is rotating that and angling that plantar surface laterally. So before you move on to lesson 5, make sure that you've completed this figure 4.1 in your lab manual, so that way you can more easily apply these actions to the specific lower limb muscles. Now, as we go through the muscles of the lower limb in the model today, we will primarily be following the outline that's present in your lab manual, which groups muscles by their location. So for example, the very first figure in this section is going to be muscles of the gluteal region. And specifically looking at the superficial gluteal and posterior femoral muscles. However, as you're studying these and learning these muscles, I'm going to strongly encourage you to also group them by their actions as well. Some people, as they're coloring in their lab manuals, will pick a different color for each one of those muscles. Another way you might do that is to assign a specific action a certain color and shade in muscles that contribute to that action with that specific color. I'm going to strongly advise you to fight the urge to simply memorize these tables that you see here. Ultimately, you will need to know 5 things for every muscle. You need to be able to identify it by its name. You need to know the origin of the muscle, the insertion of the muscle, what the action or actions of the muscle are, and then also what nerve innervates that muscle. There will be some muscles that you don't need to know the innervation, and it will identify those in your manual. But what I'm going to encourage you not to do is just simply memorize these tables. That is essentially going to train your brain to pick up and I'd be able to identify origins when you see the name, or identify an insertion when you see the name, but it's not going to allow you to do it in the opposite order. So for example, in this table, we can see here that the gluteus medius inserts into the greater trochanter of the femur, which you were introduced to in a previous lesson. You might be able to come up with that connection pretty easily if I pointed to the gluteus medius and said, well, what is the insertion of that muscle? In your head, you might say, that's the gluteus medius, and based on my table, here's what I memorized. But what happens if I give you a femur and I point to that greater trochanter and I say, identify a muscle, name a muscle that inserts at this location? Now you have to think backwards to that. And so you want to make sure that you're thinking about this in multiple ways. Learn your muscles based on their actions and their origins and insertions, and not just based on their identifications. We're going to be doing all of our muscle identification in this model, in this lesson, in this video, using this leg model that we have here. I'm showing you a couple different rotations of it. This is the anterior view of the entire leg. This is a slight anterolateral view, the lateral view, a posterior view, and then a medial view of this. Because it's very difficult to point out parts of this, to point out these muscles in the entire leg as a whole, I'm going to take it down off this stand and lay it down on the table, and we're going to focus in on individual parts of that, and I'll talk you through those identifications. So this is the model that we're going to be using to identify all of our muscles. As you can see, it's a very large model, so I'm going to be zooming in on a particular portion of it based on what we are specifically looking at and which region we're specifically focusing on at the time. I'm a big fan of this model for several reasons, but 2 that I want to point out to you. First of all, as you will hopefully notice, this is a model of a left leg. Most of the pictures in your lab manual and nearly all of the pictures in your textbook are of right portions of the body. So this is going to require you to really translate these features into lateral and medial sides rather than just looking at left and right. So it's really going to force you to think about where these should be relative to each other and relative to the skeletal components, as opposed to just thinking left and right. So I think that's going to help you out a lot. The other thing that I really like about this model is that it also includes blood vessels and nerves. And so you can use those as landmarks for each other. Frequently, muscles are going to be landmarks for identifying nerves and blood vessels, and then vice versa. I'm not going to focus on the blood vessels and the nerves too much in this video. I'll be getting to those as we move on in the next few videos in this module. Okay, so we're going to start by working on and focusing on that posterior gluteal region. Just to put us into perspective here, this is almost a direct posterior view of the leg. So this is meant to represent the region where the sacrum would be. I'm going to tip this back so you can kind of see how this has a cross section through the entire vertebral column. And recall that this is a left leg, so this is the midline of the body, and then this is heading laterally. So if we're looking at this region, probably one of the first things that you'll notice is this very large muscle right here, and that's going to be the gluteus maximus. Couple of things that I want to point out on using this muscle as an example. I want you to notice how the muscle fibers are oriented on an angle. They're not directly in a single plane of the body, as in a sagittal plane or a transverse plane, but they're on an angle, especially relative to the leg itself. while it's not always the case, and it's not a hard and fast rule, you'll notice that a lot of the times that when you see muscle fibers that are on an angle, it's going to represent a muscle that is actually acting in two different planes, and so it has the muscle that has multiple actions to it. And we're going to see that that is the case with this gluteus maximus. So as you can probably imagine, if the muscle fibers were just oriented in this vertical direction, then that would help to explain that this muscle could flex the hip. If they were just oriented in this lateral direction, then it would show that it would be a muscle that could help to laterally rotate the hip. The fact that this is doing this is located on an angle, these fibers are on an angle, should give you a pretty good clue that it can actually do both. So this is a muscle that is responsible for two actions, both extending and laterally rotating the hip. It's a large muscle, so it also has multiple points of origin and insertion. Actually has 3 points of origin on the ilium itself, the sacrum, and the coccyx. And we can see part of those where all of those different origins would be here. And then insertion-wise, it is going to insert into not only the gluteal tuberosity of the femur, but also the iliotibial tract of the fascia lata. You may have heard of the IT tract before, or the IT band. That's referring to this tract here, which is a long piece of connective tissue that goes the ilium down to the tibia itself. Notice how just below this muscle we can see another muscle, our second gluteal muscle, but notice how the fibers are oriented in a different direction. So that should give you a clue that, well, this is a muscle that is going to work in a different plane than this one. So even though these are both gluteal muscles, gluteus maximus and then right below it the gluteus medius, these do not actually have any similarity in their actions. I'm going to go ahead and remove the gluteus maximus now so we can get an idea of what's going on here at this deeper level. All right, so I've already mentioned the gluteus medius that we have here. And the gluteus medius is originating from those gluteal lines of the ilium and part of the iliac crest we can see right here. It's going to be inserting into that greater trochanter of the femur. Recall when we were talking about the bones that we said at the proximal end of the femur we had a greater trochanter and a lesser trochanter, a big one and a little one. The big one was going to have a lot more muscles that were attaching there relative to the little one. In fact, there are 7 muscles that are going to insert into that greater trochanter. This is number 1. So this muscle is going to be responsible for helping to abduct the hip. So in other words, abduct, think about it taking away. So that's taking the hip, taking the leg away from the midline of the body. And right underneath that is where you're going to find the gluteus minimus. Gluteus minimus originates from those gluteal lines of the ilium. And we can't see that because we would have to transect this muscle. And so on this specific model, we can't see that. So something to keep in mind, we've got a gluteus maximus, medius, and minimus. Maximus has 3 points of origin, medius has 2 points of origin, minimus has 1 point of origin. Just distal to those, kind of inferior to those, is where we're going to come across a set of 1, 2, 3, 4, 5 muscles that we often refer to as the deep lateral rotators. All 5 of these muscles have the same point of insertion, which is again that greater trochanter, and all 5 of them also have the same action, which is to laterally rotate the hip. So if they are laterally rotating the hip, that means they need to originate from some portion of the os coxa and then obviously insert into the femur, and as we've already mentioned, that's going to be that greater trochanter. So let's go ahead and walk through all 3 of these. I will note that this is not a great model to learn origins of on this of these muscles because it's very difficult to see the bones there. So I would go back to your skeletal bones and so you can see exactly where these muscles are originating. The first one is going to be the piriformis. Piriformis actually means pear-shaped, and as you can see that it does kind of have that triangular shape that a pear would have. After that, we've got our little trio here of the gemellus superior, the obturator internus, and the gemellus inferior. Makes sense why this is a superior, why that's an inferior. Think about the obturator internus as being in the middle, in between those two. And then the last one is the quadratus femoris. Quadratus means rectangular, a quadricep. And as you can see, this one compared to the other ones does have a very rectangular shape to it. And it is inserting into the femur, so hence the name on that one. So a couple different landmarks to help you remember those. Again, start by identifying the piriformis and then work your way down. And 2 ways to identify that piriformis: look for that distinguishing pear shape to it, but also look for this. This is the sciatic nerve. And you'll notice the sciatic nerve goes on top of all of these other deep lateral rotators, but then it dives down underneath the piriformis. So find the lateral rotator that is on top of the sciatic nerve, and that should clue you in that that's going to be the piriformis, and then we can keep on going down. So now we've rotated over to the anterior part of the thigh region, and specifically focusing at this proximal end of the thigh and looking up in the pelvic region. As you can probably imagine, the muscles in this region are going to be able to assist in the flexion of the hip. And one thing that you should notice and that I want to bring your attention to right off the bat is this white structure right here. This is not a muscle, but rather a connective tissue that we've already discussed in a previous lab lesson, and that is the inguinal ligament. So recall that the inguinal ligament travels from the pubic tubercle to the anterior superior iliac spine. So that's going to be convenient because it's not only identifying those bony markings for us, but you recall that I mentioned in that lesson that this is going to be a landmark that is going to appear throughout this course. If we look superior to that inguinal ligament, we're going to see 2 muscles in this model. One of them is coming all the way from the vertebrae, and this is the psoas major. This is originating across the vertebrae at T12 through L5, so the 12th thoracic vertebra all the way through all 5 lumbar vertebrae. And ultimately, that muscle is going to insert into the lesser trochanter of the femur. So we've already mentioned 7 muscles that insert into the greater trochanter. Now we're going to start looking at the lesser. And then you can see this flatter muscle over here that's a little more lateral, and that is the iliacus, named as such because of its origin on the ilium, and specifically in that iliac fossa. Now these are considered to be 2 separate muscles, but once they come on down and pass under the inguinal ligament, now the name officially changes to the iliacus. The iliopsoas. So we have the psoas major, the iliacus. Once they travel under the inguinal ligament, now we have the iliopsoas. And that iliopsoas is then going to insert, as I mentioned, into that lesser trochanter. There is also a psoas minor that is underneath this psoas major that assists with, or that originates on vertebrae T12 and L1, so it's a smaller muscle. That one is assisting with some minor flexion of the trunk, but it's going to insert into that iliopubic eminence that's in between the pectineal line and the arcuate line, and that's only going to assist in some minor flexion of the trunk. The psoas major, on the other hand, is going to be able to assist with some stronger and more dramatic flexion of the trunk, while the psoas major, the iliacus, and the iliopsoas, all of those are assisting with flexion of the hip. So now I'd like to bring your attention back to that inguinal ligament as we start to look at other muscles that are present on the anterior part of the thigh. Mentioned before that one of the points of attachment for that ligament is the anterior superior iliac spine. This is an important landmark because it not only as an attachment point for that inguinal ligament, but also 2 other muscles. So 3 features that are associated with this spine. So we've got our ligament, and then we have these 2 muscles. And notice as these 2 muscles come out, one of them kind of goes, projects inferiorly and then crosses over to the other side of the leg, while another one of them appears kind of short and inserts into that same IT band that the gluteus maximus was. This muscle right here, we're going to start with this one. This is the sartorius. The sartorius is actually the longest muscle of the body. And while it is originating in that anterior superior iliac spine, it is going to wrap all the way around and ultimately insert into the proximal medial tibia. So it goes all the way across then both joints. So this is the muscle that is crossing not only the coxal joint, but also the knee joint. So it's kind of bypassing the femur altogether. So that should tell you that it's going to have at least 2 actions because it's going to act on each one of those joints. In fact, this is a muscle that's responsible for laterally rotating the hip. And then, which you can probably understand based on that kind of angle motion that it has, that it would be able to rotate that leg outward laterally. And then it is going to be responsible for some flexion of the knee, and also some hip flexion as well. So again, this is one of those muscles that has its fibers located on an angle. So it kind of implying to you that it's going to have multiple actions, or at least actions in multiple planes. So flexion of the hip, lateral rotation of the hip, but also flexion of the knee. Sartorius is sometimes referred to also historically as the tailor's muscle. And the reason is I want you to sit there, if you're sitting down in a chair watching this, and go ahead and cross one of your legs. So for example, take your right leg and put your right foot on top of your left knee, almost like you would be sitting in a crisscross motion. This is the muscle that's responsible for putting you into that position. So note the 3 actions that need to take place for you to cross your leg. You need to flex your knee, you need to laterally rotate your hip, and you need to flex your hip in order for you to put your foot in that position. Those are the 3 features, those are the 3 actions of this muscle. Flexion of the hip, lateral rotation of the hip, and then flexion of the knee. So that's the sartorius. I want you to now draw your attention to the last feature, the second muscle that's coming off of that anterior superior iliac spine. That muscle is the tensor fasciae lati. Tensor fasciae lati is a muscle that is going to be special as far as the coxal joint, because it is the only muscle that you are responsible for that has 3 actions on the coxal joint. So this muscle is responsible for flexing the hip, which you can probably imagine based on its anterior location. It is also responsible for abduction, which, being very laterally located on the body, makes sense that it's going to help with abduction, so taking the leg away from the body. And then also medially rotating. And it is the only muscle that you are responsible for that medially rotates the hip. So it's special for a couple reasons. It's the only one with those 3 actions, and it's the only one that medially rotates the hip. This muscle, as mentioned, also originates in that anterior superior iliac spine and is going to insert into that iliotibial tract of the fascia lata. So now let's go ahead and bring our attention back up to this region that we've been looking at. So we mentioned these 2 muscles that are coming off that are kind of in almost like an upside down V formation. I want you to notice that right in between them, there is another muscle that is coming straight out of there. This is the first muscle that you're going to learn of the quadriceps group. In order to get a better view of that, I'm going to remove these 2 muscles. And I want you to notice that while the tendon of this muscle is coming close to that anterior superior iliac spine, it actually seems to be going down below it. This is the first of the quadriceps, and it is the rectus femoris. Rectus means straight, so this is literally the straight muscle of the femur. And this is originating from that anterior inferior iliac spine. As this comes on down the leg, you can notice that it is going to go and join up with several other muscles at this tendon right here. This is the quadriceps tendon. All 4 of the quadriceps muscles are going to insert into this tendon, which is the quadriceps tendon, which is going to connect to the patella, and then ultimately connecting and inserting into that tibial tuberosity via that patellar ligament. So I mentioned that this rectus femoris was the first of the quadriceps muscles. This is also in some ways a unique one of the quadriceps muscles because it is the only one that originates on the os coxa and inserts onto the knee. So therefore this is a muscle that is going to act on both the hip joint and the knee joint. And as you can probably guess based on its orientation, it's going to be responsible for flexing the hip, and then also extending the knee. I'm going to go ahead and remove this now so we can get a better view underneath. And now you should be able to see 3 different muscles. Muscle 1, 2, and 3. These are the vastus muscles. Vastus means great. So this is kind of a great group of muscle because they take up a large chunk of that anterior thigh. And they're named just based on their orientation. We have the vastus medialis, vastus lateralis, and then the vastus intermedius. So these are the other 3 of the quadriceps muscles. However, something to point out with these is these do not originate on the os coxa. They all originate from either the lateral lip of the linea aspera, so it kind of wraps around to that side of the femur, the medial lip of the linea aspera, or the vastus intermedius is just on that broad anterior part of the proximal femur. So all of those originate on the femur and insert onto the tibia, so that should imply to you that those are just going to be responsible for action on the knee and specifically extending the knee. Now I'd like to draw your attention to the muscles that are responsible for the adduction of the hip, so pulling the leg back towards the midline of the body. And these are, as you would probably anticipate, going to be found on the medial side of the thigh. So we're going to go ahead and I'm going to kind of angle this to give you a slightly different view. So we've already mentioned this muscle. Hopefully you recall that that is going to be our iliopsoas muscle. And then I want you to notice as we're going medially from there, you're going to come across a nerve and then two blood vessels, an artery and a vein. We're going to cover those, as I mentioned, later in this module, but I want you to think about this as being a dividing line between this muscle and this muscle. So if you're looking on either side of these blood vessels and the nerve, you should be looking at two different muscles. So once we get onto that medial side, now we're officially entering the group of adductor muscles. And the first one we're going to come across is the pectineus. It's fairly small in this model because we, again, these blood vessels are sitting on top of a large chunk of it. But the pectineus, if you recall, is originating from the pectineal line of the pubis and then inserting into the pectineal line of the femur. So it's not only based on its orientation, it's not, and it has, as we mentioned before, kind of those angled muscle fibers, but due to that location on the medial side and also the anterior side, it's not only adducting the leg, but then also assisting with hip flexion. And then from there, if we continue to move medially, we're going to get to our three adductor muscles. So if you recall, there's three: the adductor brevis, adductor longus, and adductor magnus. So short, long, and big. The adductor brevis actually can't be seen here. I'm going to zoom in just a little bit and show you that while it's there's only this tiny little bit of it that can be viewed, this little triangle. It's not even labeled on this model, and that's because the majority of that muscle is going to be located underneath the adductor longus, which is the next one here. So next muscle, as we continue to head medially, this is going to be our adductor longus. And then as we continue to move around to that medial part of the leg, here's a dividing line between the adductor longus, and then this is a little bit of the adductor magnus that's peeking out underneath this muscle, the gracilis, and we'll come back to that one in a minute. So again, adductor brevis, adductor longus, adductor magnus, and we have to continue rotating this around to really get an appreciation for how large that adductor magnus is. So this is all still part of the adductor magnus. So it goes from here all the way around to there. And I will say in your current textbook, it doesn't really give a direct medial view of the thigh region. So I think it's sometimes difficult to get an appreciation of just how large that muscle is. So all of these muscles are inserting into that linea aspera of the femur. And as you can probably imagine, the adductor brevis is inserting most proximally off of that linea aspera. Adductor longus is then a little bit more distal to that, and then the adductor magnus is most distal. But the adductor magnus, if you recall, also has 2 points of insertion, not only the linea aspera, but also the adductor tubercle, hence the name. We'll get a better view of that from a different perspective here in a bit, but you can see part of it right here where, which is the part that is inserting into that linea aspera of the femur. You'll also notice that those blood vessels and nerves we were following before come down here, and then, so we're still in that anterior part of the body, and then they disappear. So they're going to be traveling through that adductor hiatus, that gap in the adductor magnus, and we'll get another view of that. Another view of that in a little bit. I do want to come back to that gracilis that I mentioned before. The gracilis originates from the inferior ramus of the pubis, which we can see up over here, and then it's ultimately going to insert into that proximal medial tibia, so the same location where that sartorius was inserting. And this is going to be, the gracilis is going to be responsible for not only adducting the hip joint, because it's with that group of adductor muscles, but also flexing the knee joint, which should make sense to us as well, because that's it's inserting in that same location as the sartorius. So you can remember that those two are having the same action on the knee. Now, the last part of the thigh we're going to look at is the muscles that are associated with the posterior femoral region. This is where you would find the, quote, hamstring muscles. All 4 of those muscles are going to be responsible for flexing the knee. In addition, 3 of the 4 that are back here are also going to be responsible for and contribute to the hip extension. So that should imply to you that 3 of these 4 muscles we're going to talk about originate on the os coxa and insert onto one of the lower leg bones, but one of them does not. Okay. I want you to think about these muscles again. Try not to think lefts and rights, but I want you to think about medial and lateral. So looking at our model here, recall that this is the medial side of the leg. And so here we can see this is going to be the group of the 2 medial muscles, and those are going to be the group of the 2 lateral muscles. All 4 of these, or of the 3 muscles that are coming from the os coxa, are all coming from the same region. They're all coming from that ischial tuberosity. And the 2 that are on the medial side share the same origin, and the 2 that are on the lateral side share the same origin. So we're going to go ahead and start with the ones that are on the medial side. It's a little difficult to tell on this model, but these 2 muscles are put together in a single plastic component. But you can notice here that we've got one muscle here, right, that's up against this midline gap, and it's coming here from that ischial tuberosity. But you can see when I get down to about here, now you can see this long tendon of this muscle. But if I head just to this more medial side, this is actually a different muscle. So this is one muscle, and this is the second muscle. This muscle right here that has the long tendon, where the tendon becomes visible more proximally, that is the semitendinosus. And then if we look more towards that distal end, we can start to see that next muscle appear not only down here, but then also right there. This is the semimembranosus. So the semitendinosus has the long tendon to it. The semimembranosus is more of a flat sheet, and this tendon goes on top of it. But both of those are going to insert together into that proximal medial tibia, which, if you recall, was also a point of attachment for the sartorius and the gracilis. So it's a popular location. So semitendinosus and semimembranosus are there. Again, both coming from that ischial tuberosity. Also coming from the ischial tuberosity is going to be this 4th muscle, or this next muscle that is also up along this midline. This is one of the biceps femoris muscles. You probably think when you hear the term biceps, you think about your arm, but biceps literally means 2 heads. If you have a muscle that's labeled as a biceps muscle, that means those 2 muscles have 2 different heads, 2 different origins, but they have the same point of insertion. These 2 muscles on this side are the biceps femoris long head and short head. The long head has the origin that is furthest away from the insertion, while the short head has the origin that is closer to the insertion. So the biceps femoris long head is the one that's going to originate at that ischial tuberosity, and it's going to come all the way around and insert into the head of the fibula. The biceps femoris short head does not originate from the ischial tuberosity, so it does not contribute to any hip action. That one is going to be underneath, and we can see a little bit of it kind of peeking out right here. And the biceps femoris short head actually originates from the linea aspera of the femur, but it is also going to join up with that biceps femoris long head to insert into that head of the fibula. So a couple ways sometimes people start to get confused about which muscle groups are on which side. If you can remember that the 2 biceps muscles, the ones that are associated with heads, biceps, seps meaning head, those are the ones that insert into the head of the fibula. The fibula is the lateral of the 2 lower leg bones. So that should help remind you that the biceps muscles are the lateral ones, and then the semitendinosus and semimembranosus are the medial ones. And as I mentioned, semitendinosus, the semimembranosus, and the biceps femoris long head, they cross both joints, so they will flex the knee and extend the hip. However, that biceps femoris short head is only going to be responsible for flexing the knee. It's not going to have any contribution to the hip action. Now, I do want to remove these just to point out one other feature here. Now that I've taken these out of the way, I think you can get, again, a better appreciation for the size of that adductor magnus that we were talking about before. So again, gracilis
Here's the adductor magnus, and I want you to see how a lot of it is still visible here on that posterior region, but only if the semitendinosus and membranosus are removed. Now also recall that we said on this side we could see those blood vessels and nerves disappear, and now they're going to appear again. So this adductor magnus, we can see how this region of it is going to insert into that adductor tubercle of the femur, while this part of it is going to end up inserting into that linea aspera. So once it splits and heads its two different ways, now it has a gap in the muscle. That is the adductor hiatus, hiatus meaning a gap. And so this is literally the gap in the adductor magnus. So now as we move on to muscles of the lower leg, I really want you to be thinking about these muscles in terms of their actions and not just specifically where they're located. Almost all of these muscles, actually I think all but one of these muscles that we're going to discuss in this region contributes to one of two actions, either plantar flexing or dorsiflexing the foot. So recall that the plantar surface of your foot is the sole of the foot. So anything that is responsible for plantar flexion is essentially pointing your toes, while dorsiflexion is bending your foot, bending your toes up towards the anterior part of your lower leg. As you can probably imagine, we would expect muscles that are on the posterior part of the leg to be assisting in plantar flexion, and then muscles that are on the anterior part assisting in dorsiflexion. Then as we continue on through these, I also want you to be thinking about whether these muscles are more medial or lateral. So are they assisting with inversion or eversion of the ankle? And then also whether they are going all the way to the ends of the digits, and so assisting with moving the digits, flexing or extending the digits, or if they are just moving the ankle joint itself. We're actually going to start with the posterior side of the leg here. So you can kind of get a view of this, and we're going to start with the superficial muscles and then kind of remove those and start working even deeper. Hopefully you recognize this bone. That is the calcaneus, the heel bone. And as we mentioned when talking about that bone previously, this is where the calcaneal tendon is going to attach. And there are a total of three muscles that are going to insert into the calcaneus. One of which is the gastrocnemius. Gastro means belly, stomach, and so this is a muscle that has some very prominent muscle bellies. If you were to kind of point your toes and feel that muscle that sticks out there on the proximal part of your lower leg, that's the gastrocnemius. So there are the two bellies. There's a lateral belly and a medial belly. You don't need to know those for our purposes. Just know that this is the gastrocnemius. So the gastrocnemius does originate above the knee. So even though it's inserting all the way down into the heel, it's going to have some effect on the knee as well. So it is going to be responsible for some flexion of the knee, but then also plantar flexion of the foot. If I remove this muscle, we're going to see another muscle that is below it. And we can kind of see that muscle here. It's a very flat muscle. It's the soleus. The soleus means fish, and so you can kind of see the fish-like shape that this muscle has. And so this muscle is also going to be attaching to the calcaneus via that calcaneal tendon, via that Achilles tendon. So when you tear your Achilles tendon, essentially you're severing these muscles right here. So these massive muscles that are in that posterior part of your thigh that also assist with your knee, those are the muscles that are going to be damaged in that kind of injury. I'm going to tip this back a little bit. You can see this white band here. This is a tendon from a muscle that's from the plantaris muscle. The plantaris muscle actually originates up at the distal part of the lateral femur, and this is part of that muscle right here. I'm going to kind of tip this to the side. This is the muscle belly, and then here's the tendon, and this tendon goes all the way down here in between the gastrocnemius and the soleus in order to insert into the calcaneus. This is the plantaris, and so as you might be able to deduce, this is also responsible for plantar flexing the foot. But recall, because this one is originating up on the femur, it is also slightly assisting in that flexion of the knee. However, the soleus, the fish muscle, that is actually originating from the soleal line of the tibia. Hopefully you recall that marking when we said that that was named for the muscle earlier. And then also part of the proximal fibula. So because this muscle is originating on the tibia and the fibula, it is not crossing the knee. So the only thing the soleus is going to be doing is plantar flexing the foot. I'm going to go ahead and remove all of those. So now we can get a better view of this deep region. I want to start by looking at this deep region by focusing on what's going on here at the knee. You'll recall that this posterior triangular surface of the femur is referred to as the popliteal surface, and this entire region is the popliteal region. We'll talk about this again after we've discussed blood vessels and nerves, because as you can see, there's a lot going on around here. But I want to point out this muscle here that is fairly short. It's going on a little bit of an angle there. That is actually the popliteus. Popliteus originates from that lateral condyle of the femur. So these are the two condyles of the femur, lateral side, medial side. And then it's going to insert into the tibia and the proximal part of that tibia on the posterior side. So it's not very long. It helps to flex the knee, kind of helps to unlock the knee a little bit, and provides a slight medial rotation of the tibia as well. Notice how just lateral to that one, we can start to see a bone here. This is that head of the fibula. So as we're looking at these muscles here on the back, I want you to keep in mind that that's the fibula and that this part is pretty well exposed, and we can see it easily when we've removed those superficial muscles. However, we cannot see the tibia, so we just have to kind of imagine the tibia being below these muscles. Once we get past that knee region, now we get to the group of three. There are going to be three muscles on the posterior side of the lower leg that have very similar names to the three muscles that are on the anterior part of the leg. All of these are going to and they're going to be named based on not only what they do, but where they're located. As you can imagine, if a muscle is located on this posterior region, we've already mentioned that it should be associated with plantar flexion of the foot or flexing of the digits. So we want to think about our flexors being on the posterior region. On the other side, we're going to have not only dorsiflexion, but extension of the digits. So those are going to be our extensors. So I want you to think about this as our group of three flexors, 1, 2, and 3, and then on the other side we're going to see our three extensors. I'm warning you now that they are not in the same orientation, not in the same order on the posterior and the anterior side. So you really need to think about where those muscles are going. Sometimes one of the best clues to identify a muscle is follow the tendon. Take that muscle and don't just pay attention to where that muscle belly is, but follow the tendon to see where it originates or where it inserts, and that should help you out a lot. So let's go ahead now and look at these muscles in a little more detail. Once you notice, if we're looking at the proximal crural region, we can see one muscle that's here in the middle, and then it kind of disappears, and then there's two other muscles that are a little more prominent the further down we go. This muscle that's right in the middle is the tibialis posterior. The muscle that is more lateral is going to be the flexor hallucis longus, and then the flexor digitorum longus is going to be the more medial muscle in this region of the leg. Notice that it's actually the flexor digitorum longus that is up against the tibia here in that crural region, so don't get confused by that. So the tibialis posterior is not right up against the tibia in this view that we have, but it's going to be the one that's right in the middle here. The other kind of landmark I wanted to point out for you here is the fibula itself. So here's that head of the fibula, and then we can see that this region is pretty exposed once we've removed those superficial muscles, but now we can see that this muscle is going to originate on the posterior distal part of the fibula, while the proximal part is kind of left alone. So our tibialis posterior is going to be the one in the middle, and then it's going to disappear. This one, the flexor hallucis longus, flexor hallucis, flexing the hallux, obviously needs to insert onto the hallux somewhere, and specifically it's going to be on the distal phalanx of that. And we can start to see the tendon appearing right there, and if we were to look more closely, that is going to pass around. Here's that medial malleolus. It's going to kind of be passing around there and more posterior, and ultimately coming all the way out here and going out to that plantar surface. So that is where that flexor hallucis longus is going to be. That more lateral one, as I mentioned, the more medial one, that is going to be the flexor digitorum longus. And so that one is going to come on down here. We can follow its tendon, and then it's going to disappear from our view on this model, and we can't actually see the points of insertion there. But that flexor digitorum longus is originating on the posterior part of the tibia. And we can kind of see part of that where it would be right underneath there. Some mnemonics for remembering these are to follow the tendons, but specifically follow the tendons around that medial malleolus of the tibia. So if we look more closely at that region, we can see how even though the tibialis posterior is the one that is the middle muscle up here in the proximal crural region, once we head down, you can see how its tendon then reemerges underneath the flexor digitorum longus. So once we get down to that medial malleolus, the tendons are in a different order than the muscle bellies. So we can see here's our tendon for the tibialis posterior, the flexor digitorum longus. We've got some blood vessels and nerves, and then there's going to be the flexor hallucis longus. So tibialis, digitorum, hallucis. You may have heard the phrase before, Tom, Dick, and Harry. It kind of means everybody. So if you were to say, oh, every Tom, Dick, and Harry was there at the party. Oh, that means, everybody was there at the party. Tom, Dick, and Harry is the way to remember these. So Tom is tibialis posterior, Dick, flexor digitorum longus, and Harry, flexor hallucis longus. So that's going to be the order of the tendons if you're looking in this region. However, keep in mind, again, if you're looking up more towards that proximal crural region, you're going to expect to find that tibialis posterior in the middle before it disappears underneath that flexor digitorum longus. The last thing I wanted to re-emphasize as far as their action goes, but especially keeping in mind with the tendons, the two flexor muscles, the flexor hallucis longus and digitorum longus, both of those are not only plantar flexing the foot, but then also flexing the digits. The tibialis posterior, however, is not going all the way to the digits because it's going to be inserting into several bones of the ankle and then also the metatarsals. So it can't flex the digits. But remember, when we're thinking about the tibia, the muscle that says tibialis, it's associated with the tibia. Tibia being the medial bone. So if you were thinking about how the ankle moves, if it's moving, you're taking that sole of the ankle and moving it, pointing it medially, you're inverting the foot. While if you move it laterally, that's the eversion. So the tibia is the more medial bone. So the tibialis muscles, the ones that have tibialis in the name, are not only either plantar flexing or dorsiflexing, but they're also involved in inversion of the foot. So these two muscles are just flexing digits and plantar flexing. Tibialis posterior is not only plantar flexing, but also involved in and contributing to inversion of the foot. So let's now keep rotating around a little bit and have a look at the lateral side. What's the lateral bone of the leg? The fibula. So there's two muscles here that are going to be associated with the fibula, the fibularis longus and the fibularis brevis. If we were to look at this muscle right here, we can see that we've got a muscle belly and then the tendon appears pretty quickly, and then by the time we get to here, we're only looking at the tendon. But you can see there's a muscle that is underneath it. This is the fibularis longus, and then once we get to that tendon, we can see the fibularis brevis that's underneath it. That fibularis longus is going to be originating from the head and the proximal lateral part of the fibula, while that fibularis brevis is just going to be the lateral part of the fibula because it's shorter. It has an origin that is located more distally. Both of those are also involved in plantar flexion. So we've only been talking about plantar flexion thus far, but because these are on the lateral side of the leg, these are going to assist, because the muscles are on the lateral side, these are going to assist with eversion as opposed to inversion. So again, the muscles that have the name fibularis in them, the fibula is the lateral muscle, these are everters. The ones that have tibialis in the name of the muscle, those are medial, those are going to be inverting the foot. Insertion-wise, I want you to notice here that this tibialis, or excuse me, the fibularis brevis, part of the reason it's called brevis is also because its insertion is much closer. So that muscle is going to come in and it's actually going to insert right here at the base of the fifth metacarpal. The fibularis longus is going to actually go underneath the foot and wrap all the way around to the base of metacarpal 1, and then also the medial cuneiform. So you can't see where the rest of this tendon goes, but just know it goes all the way around. You can see some images in your textbook and lab manual that have this muscle isolated, and you can get a better view of the route of the tendon. But so the other way to confirm whether you're looking at the longus or the brevis, again, follow the tendon. If you're seeing that the tendon goes and it stops right at that base of metatarsal number 5, then you know you're looking at the fibularis brevis as opposed to the longus. So let's keep going around now, and we're going to move to the anterior group of muscles. So on the anterior side of the leg, this anterior crural region, we are also going to expect to find 3 muscles that are kind of the opposites or the equivalents of the Tom, Dick, and Harry on the other side. So, but instead of having a flexor digitorum longus and a flexor hallucis longus, here's where we're going to find our extensors hallucis longus and our extensor hallucis longus. In addition, we're going to find the tibialis anterior here. Now, as I mentioned, these muscles are in a slightly different order on the anterior side and the posterior side. So again, kind of start with your landmarks. We're going to start with the tibia itself. One thing you'll notice in this model is that as we're following this tibia down, especially on the medial side there, kind of the anterior medial side, there's no muscle on top of it. That's why it hurts so much when you hit your shin. You can actually feel this bone almost right underneath your skin, so there's no muscle protecting that. This line right here is kind of the top of that triangle of the tibia, and recall that that's called the anterior border. Which muscle is up against the anterior border of the tibia? The tibialis anterior. And we can see that that tibialis anterior comes around here, it crosses the ankle, but then the tendon stops. So it's inserting into that metatarsal, that first metatarsal, and then also that medial cuneiform. So the fact that it's stopping there should tell you it doesn't do anything to the digits. We've already mentioned that it is an extender, a dorsiflexor. So it's dorsiflexing the foot. But then again, it's a tibialis muscle, so it's also going to be involved in the inversion. So the tibialis anterior and tibialis posterior are both synergists and antagonists. They both invert the foot. So in that, from that perspective, they're synergists, but one of them is a dorsiflexor and one is a plantar flexor. So in that way, they are antagonists. If we look at then the rest of the muscles, we can see another muscle that's here on top. And this muscle is going to be the extensor digitorum longus. And we can see if we follow this muscle, follow that tendon, that this tendon is going to go here and it is ultimately going to go to digits 2 through 5, just as we saw with the flexor digitorum longus. So this is ultimately going to insert into the distal phalanges on that dorsal surface of digits 2 through 5. So because this one's going all the way to the digits, it can not only dorsiflex, but it's also able to extend the digits. Now, to get a good view of the extensor hallucis longus, we actually need to take this muscle off. So I'm going to take this one, and we could kind of see if we were to follow that tendon. This is obviously the tendon of the extensor hallucis longus, but then we can't really get a very good view of the muscle. So if we take this and turn it around, now we can actually see the extensor hallucis longus there underneath. Now, the last thing I wanted to bring up before we leave muscle models behind is to remind you that as you're learning these muscles, it is going to be very important for you to be integrating this information. Learn it A to Z and Z to A. Don't just think about how you need to identify a muscle on a model or a chart, and then based on that identification, you can pull out of your mind, what the origin, insertion, and action are. Instead, you need to be thinking about it in the opposite direction as well. If I was to show you either an os coxa or a femur and ask you for any one of these points, what is the muscle that originates there, or what is the muscle that inserts there? You should be able to tell that, and you should be able to identify a muscle by looking at a bone. I've actually taken this model here and I have taped in red the origin of every muscle that we've talked about, and in some cases multiple muscles with one piece of tape. So as you're studying these bones, I don't want you to just be thinking about the bones and the bony markings. You can study muscles by looking at bones. Here on the femur then, I've also made some tapes. I've taped in blue the insertions of these muscles that are here marked in red, and then you can also see some other red markings that I've made showing where there are also muscles originating on the femur. It's typical in anatomical shorthand to identify origins with red color and insertions with blue. So I'm going to encourage you to continue studying these muscles, but doing it from a bony perspective as well. Go back to the images of the bone, go back to the videos of the bone, and study your muscles that way as well.